Hey everyone, welcome back to the Vital Signs Vlog, your trusted source for cutting-edge health insights, wellness tips, and expert advice on staying protected through adulthood. Today, we're diving into an essential topic, recommended vaccines for adults and seniors, from flu and COVID-19 to pneumococcal, shingles, and more. You might think vaccines are just for kids, but as we age, immunity fades, and certain diseases hit harder, making boosters crucial for health. Guiding us through this is medical expert Reilly Allmoslecher, a family nurse practitioner and clinic director at American Family Care Joplin, whose clinical expertise highlights why these shots matter for you and your community. Stick around as we cover why adults need them, factors influencing recommendations, checking your status, and key vaccines, because staying current boosts vital signs like immune strength, respiratory health, and overall vitality. Let's start with why adults need vaccines, even if you got them as a kid. Reilly Allmoslecher explains, vaccine immunity wanes over time, so shots from childhood may no longer be effective. Bacteria and viruses evolve, and older adults face higher risks from infections. So updated vaccines prevent severe illness or reduce symptoms. Plus, there's herd immunity. When enough people vaccinate, diseases can't spread easily, protecting vulnerable folks like babies or those with weakened immune systems. If everybody gets vaccinated, some illnesses could even disappear. Reilly notes, your specific needs depend on age, immunization history, job, travel plans, and current health. Talk to your provider to tailor them. Not sure about your vaccination status? Reilly advises a quick antibody blood test at places like AFC Joplin to check immunity levels. No digging through old records needed. If levels are low, boosters can fill the gaps. Now, onto the recommended vaccines for adults, based on CDC guidelines for 2025. First, the flu influenza vaccine. Get it annually in early fall for everyone 6 months plus, especially if pregnant, 65 plus, with chronic conditions like diabetes or heart disease, or caring for infants. It guards against serious flu complications. COVID-19 vaccine. Updated shots for 6 months plus, with a second dose recommended for those 65 plus given 6 months apart or moderately/severely immunocompromised to lower severe infection risks. Reilly says, it may not prevent illness entirely, but it cuts hospitalization chances. Tdap tetanus, diphtheria, pertussis. Booster every 10 years for adults 19 plus during pregnancy or around young kids to protect against whooping cough. HPV vaccine for ages 9 to 45 extended from 26 in some cases, preventing cancers like cervical, penile, or throat and genital warts. If you missed it as a kid, catch up now. MMR measles, mumps, rubella. For adults under 50, if not fully vaccinated, check with your provider for a booster if needed. Hepatitis B vaccine, strongly for 19 to 59, and for 60 plus at risk or anyone wanting protection against liver-attacking infections. Varicella chickenpox, 2 doses if you never had the disease or vaccine, severe in adults, so prioritize if born before 1995. RSV vaccine, for 60 plus and pregnant to protect fetuses, as RSV hits seniors harder with declining immunity. Shingrix shingles, strongly for 50 plus, preventing painful rashes from reactivated chickenpox virus. Pneumococcal vaccine, for 65 plus or younger with risks like smoking, diabetes, cancer, or heart or lung issues. Protects against pneumonia, meningitis, and more. Maybe one time or with a booster. For healthcare workers, stay current on all, plus meningococcal if required by your employer to prevent bacterial meningitis. Heading overseas? Check CDC's traveler health site for destination-specific needs like typhoid, rabies, cholera, yellow fever, or Japanese encephalitis, on top of routine ones. Wrapping up this Vital Signs vlog on adult and senior vaccines. Huge thanks to medical expert Reilly Allmoslecher, FNP and Clinic Director at American Family Care Joplin, for her invaluable guidance on staying protected and promoting herd immunity. Don't wait, walk in or schedule at AFC Joplin to discuss your needs and get vaccinated. Your health and the Joplin community's depends on it. Drop your vaccine questions below. Hit like and subscribe, and share to spread awareness. Until next time, keep those vital signs strong, vaccinate, and thrive. If you are feeling under the weather, you can walk into American Family Care Joplin 7 days a week with no appointment to get a diagnosis. We will have you feeling better and back on your feet fast. AFC Urgent Care Joplin, located off 3rd and Range Line behind Starbucks. American Family Care, the right care, right now.